Here to talk about depression, especially for people that have inflammatory bowel disease, ulcerative colitis, Crohn's, um, to talk about the link with depression because it's an important link. Um, Over the last year, since the start of COVID, uh, depression has tripled, at least in the U.S., where these numbers, the study is from. It's tripled. That's a humongous number to increase threefold. Um, and the fact is, depression is just much easier to see in other people, to spot depression in someone that we're close to. Um, Rather than kind of seeing it ourselves. It can be a very kind of gradual, subtle thing that can kind of take over, and we can have a little bit of a blind spot for ourselves. So asking the question of "Am I depressed?" is an important one, especially if you have um, inflammatory bowel disease, because we know that depression, similar to anxiety and just significant chronic stress or going through trauma, can really worsen the disease. It's proven that depression can, we'll just speak about depression itself just today, can trigger flares. It can make it so future flares are easier to kind of get triggered, so the threshold actually goes down. It can make your disease worse. It can increase the chance that you might need to get hospitalized and make it harder to get into remission, as well as uh, how long that remission uh, will last for. So there's all types of studies and data around this, but it's just very clear from the big picture, depression makes IBD worse. And on the same token, it's a two-way street. This is a kind of a brain gut issue here. Um, People with IBD, if you're not already depressed, are 6 times more likely than the average person to become depressed at some point. So it's really an important one to be on your radar. So if we think about, am I depressed? It's a little bit of a tricky question because there's no blood test, there's no easy absolutely yes or no. It's really made of a lot of different factors. So a licensed mental health professional can really, make this a definitive call for you if you're struggling with depression or not. But for right now, there are 9 factors that you could consider. So the first one would be context. If you're feeling really down and out, but something major just happened in your life, you lost someone, or you lost a job, or you just got diagnosed, or something big like that, it's completely normal and healthy to feel pretty low and down and depressed for a little period of time. Even extreme sadness can be a very normal thing. But if it feels like it's out of proportion or just not going away, it's been many weeks and it's just not going away, that's a point of concern to kind of ask or think more about this. And also, if we think about context and timing, depression can get triggered from seemingly out of nowhere, not linked to any big change. It kind of can just show up. The second factor would be feeling really sad, down, or empty. Um, these are this is pretty much the hallmark of depression. If you're feeling sad or down or empty or hopeless, that's definitely a warning sign there. It's also common to just feel very tearful, seemingly no out of nowhere. Doesn't need to even be that you're thinking of anything really sad. You can just become very tearful or tearful very easily, which can be confusing and embarrassing as well. But that's also somewhat of a common symptom of depression. The third factor would be if you're just kind of avoiding stuff. If you're just kind of saying, I just don't feel like it a lot. If you're avoiding things that you generally have liked to do in the past, this could be called, could be what's called anhedonia. Anhedonia is the loss of pleasure or positive anticipation or kind of excitement about doing things and life in general. And when that goes away, it can just feel like everything's a chore. It just feels like, I'm sure it would make me feel better, but I just don't feel like I'm into it. Um, and this is different, though, than avoiding situations or social situations because you're concerned about, having some GI symptoms. That would be different. Number 4 would be your appetite. Appetite is obviously very connected to your disease activity, so we don't want to read too much into this because it could be just your disease if you're noticing a big change. But if you are noticing a significant change and it's going with these other factors here, either big increase in appetite, maybe especially for carbs, or just a lack of interest or lack of hunger and missing meals, that's a factor to consider. The 5th of 9 would be how your energy is. And in inflammatory bowel disease, fatigue is possibly the most common shared symptom. Well, it's certainly one of the biggest of them, most common of them. And for me personally, it's the most annoying symptom that I have to deal with my Crohn's disease. So that could be hard to tease out because fatigue is a part of depression. So there's 2 questions you can ask yourself to kind of pull this apart a little bit. One is this big drop in energy, is this a recent change, or is this kind of just part of what's been going on for a while, or when the disease gets bad? The second question would be, if you're really exhausted and tired all the time, do you also notice a drop in motivation? That could be more about depression if it's a drop in energy and a drop in motivation at the same time. So the 6th one here would be your concentration. How scattered are you? And most people would, at this point, would say something, they experience some type of distractibility during their day just because of the modern life and notifications and emails and all this multitasking that we do. But if you're noticing a significant decrease in concentration to the point that it's hard to read things at length, you can't really complete projects, or maybe even follow conversations fully because your head is so foggy, that's a warning sign. Number 7 would be how your sleep is. Is there any change? It could be change toward insomnia, where you can't fall asleep initially, or you're waking up in the middle of the night, or you're waking up too early. That is a part of depression for some people. For other people, it's a swing the opposite direction. It's called hypersomnia, where you just don't want to get out of bed and you're sleeping for long periods of, over 9 hours. And part of it is you kind of are sleeping. It's a bit of kind of shutting out the world, and exhausted and just sleeping instead. The 8th would be feeling really guilty and really self-critical. It's often the case where someone becomes depressed, the inner critic just gets supercharged. Just picking out anything to kind of make you feel less about yourself or less compared to other people, that can really get amplified, and it makes people wall up, makes them kind of avoid other people and isolate, which just makes things worse in the long term, the more people isolate. And the last factor would be if there's any thoughts about harming or killing yourself. This is a part of depression for a lot of people. And it can feel, when you're in the depths of depression, like there's no way out. It can feel like you're cornered, and it's hopeless. But this is certainly not the case. There are many treatments for depression that are effective. They might take a little while, but they're effective for the vast majority of people. So if that is the case for you, the National Suicide Prevention Line is open 24/7. It's a really great resource just to be able to talk with someone. So if this has you curious or thinking more about if this might apply to you, one potential next step is you can go through these types of questions with a little bit more detail and answer them and get a little bit of a score on a kind of approximation if you're in potentially a depressive episode, if it's mild, if it's moderate or severe. The most widely used test that medical and mental health professionals use for depression is called the Patient Health Questionnaire 9, or PHQ-9. If you just Google PHQ-9, you'll find it, and you can find what score fits for you. Please let me know if you have any questions. I'm here to help.